I am honored to be your moderator for today's session. My name is Dr. Aidela Fonda. I am a training manager from Sinclair Indonesia. So before we begin, I would like to welcome our participant to this webinar. It's a pleasure to have each of you here tonight. Before I introduce our speaker, I would like to remind everyone to keep their microphone muted during presentation. If you have any technical difficulties or question, please feel free to reach out our technical support team via the chat feature. So this webinar will divide into two sections. The first is presentation from our speaker, and the second is a Q&A section. I encourage each of you to actively participate by asking questions or sharing your perspective using the chat feature below in the question and answer column. And our topic tonight is a safe and effective dual action treatment for instant lifting and collagen stimulation with Ellanse. Our speaker tonight is Dr. William Ko from Taipei, Taiwan. Thank you,
Hello, everyone.
Thank you, Doctor. We are honored to have you with us today. So,
Yes, my pleasure.
Thank you, Doc. So, Dr. William Ko is a dermatologist with his extensive experience in aesthetic injectable. And Dr. William is also a trainer and a speaker for many aesthetic conferences. Okay. So this is the CV from Dr. William.
Yeah.
Okay, Dr. William, you may share your presentation, please.
Yeah. Let me share my screen first. Yeah, is that everyone can see the screen?
Yes, Doc.
Yeah. Hello, everyone. I'm Dr. William Ko from Taipei, Taiwan. It's my pleasure to share my knowledge and my experience of using Ellanse for the aesthetic treatment. So today I'm going to share some insight because I heard that Ellanse is quite new in Indonesia. And so I will divide the talk to some part. First of all, to the basic knowledge or the knowledge or technique that you should know before the injection. And the second part, I think the more important part is to share the real case, long-term follow-up to when I use the Ellanse for the whole facial rejuvenation. So before I start the content, I would like to share today's patient to see the before picture. And please imagine that if this is your patient, 52-year-old female who complained about her eye bags, nasolabial fold, and overall sagging. What is your treatment plan for her? If you use only Ellanse, how will you inject her? So the 45-degree and 95-degree view, and the other side. So before I move on to the content, I would like to ask the audience to think about it, or you can make some plan before injection. And later I will show you my technique and my injection plan for her and the result long-term follow-up. So today's content, of course, we have to introduce Ellanse, and maybe I will talk a little bit about anatomy and facial aging and the benefit of Ellanse. And the fourth part is the best practice. It's about the technique, and I will show you the illustration and a teaching video from Sinclair to share some footage or film to according to the part that I want to inject and to share the tips to you. And the fifth part is the long-term follow-up. The 52-year-old female, her follow-up result, I believe that is more interesting because when we use the collagen stimulator, all I want to know is the follow-up neocollagenesis effect. Is it real? And how does it? How long will it last? And the last part, I'll talk a little bit about the biostimulator comparison with from Ellanse to like Radius or Gori or Etherfield. I heard that in Indonesia there's no Sculptra, so I won't talk about Sculptra. So the first part, introduction of Ellanse. We have to know the composition beforehand. That the unique composition of Ellanse is the PCL. We call it polycaptolactone microsphere. It's composed of 30% of the whole syringe. And the other part, the CMC, it provides the immediate supporting ability to provide the immediate result of the injection. So the CMC property is natural material derived from the cellulose, and it is generally recognized, it's safe by FDA. So it will resolve in 2 to 3 months. So it provides the immediate supporting ability of Ellanse. And later on, the PCL neocollagenesis effect will catching up. And the PCL is resolvable. And we have to keep in mind that the microsphere is around 25 to 50 micrometer. It is perfect, not too big or not too small. If it is too big, it will cause too much inflammation. And if it is too small, it will produce less collagen. So I think the ideal microsphere is about 25 to 50 micrometer. So as we know that the Ellanse divided to two type, S and M. And the S it will last around 1 to 2 years, and the M type lasts longer. Why? Because when we increase the length of a PCL chain, it will decrease the bioresorbability of Ellanse, and it increases the longevity. So for the injection part, you will see that the property or the injection field is pretty much the same between S and A, but the longevity is different because they increase the length of PCL chains. So it will decrease the bioresorbability of these two types. So PCL, we know that is safe, and the diameter is very ideal to produce good adhesion, growth ability, morphology of mitochondria or fibroblast to sustainably produce the collagen. So the mechanism of action is that two, like we said, step one, immediately due to the CMC volume effect, and then neocollagenesis, it produces long-lasting neocollagenesis effect. So when we see the Ellanse mechanism of action, clinical effect mainly in the beginning is the CMC, and then the PCL. CMC effect will go down gradually. After 1 to 3 months, it will absorb, and the PCL effect will catching up. And the ideal clinical effect will start at 3 months to 6 months. I will show you the real world case to see the effect. And for S, it will last 12 months or even longer if you inject enough volume. That's very important. So later, when I do the case sharing, I will show you the result. And the anatomy or facial aging, I won't talk too much because all we want to know is the layer of the face: skin, subcu, muscular aponeurotic, pretending ligament, and the periosteum or supraperitoneal bone fascia. So the mainly injection level is level 2 to level 4. And when we touch the bone and inject the bolus, it is the main way to inject Ellanse. So the green injection technique with Ellanse, you can inject in the sub-Q or the supraperiosteum injection. When we inject in the sub-Q area, you have to be bear in mind that you should inject evenly and to use tiny bolus technology and in the supraperiosteum injection. Also, we will the injection volume should not exceed like 0.2 ml per injection because we want the bolus to touch the environment to produce more produce more collagen. So we know that aging is multifactorial process from bone, muscle, fat, skin. So we have to compensate the volume loss and the repositioning effect. So Ellanse has a good supporting or G prime that we know that it can produce the volume or reposition the fat when you inject properly. So for the best practice, it's about the technique. So like we say, when you inject sub-Q, you can use the linear threading, fanning, cross-hatching, or retrograde manner. And we have to bear in mind that the linear thread is usually, I will tell you that 0.1 cc per linear thread. And the purpose of technique is to create a scaffold for effect compartment and subsequently restore the volume. For the supraperiosteum plane, the bolus deposition should not exceed 0.2 cc per bolus. So what we want to know is to increase the surface area of craniofacial platform to increase more contact surface for the follow-up neocollagenesis. So the general guideline of the injection, you have to bear in mind that low pressure injection is very important, and the mixing with the lidocaine with the syringe. So the mixing with the lidocaine, a maximum of 1 cc Ellanse is 0.2 cc lidocaine. Not too much because we don't want to disturb the rheology or the G prime of the Ellanse. And the low pressure injection is for safety, and you have to watch the patient's reaction, pain, or skin condition for the safety for the safe injection. So, like we say that the sixth layer, we should bear in mind that sub-Q or supraperiosteum is the ideal part. So the philosophy of injection is from top to bottom and from outside to inside injection, and you can inject deep to superficial. So that's the main principle of injection. So like temple area, like you can use bolus injection or the cannula injection. This is the illustration of the expert's guide, but usually you can the opening can be in the hairline, or otherwise you can open in the temporal crest area to use a linear threading technique to inject down to the whole temporal area. So later I will show you the Amanda Ong's teaching video for the temporal area injection. Let me check.
To proceed on bone. Okay. So I'm on bone here. And boluses on bone should not exceed 0.2 mils.
Should not exceed 0.2.
So with Ellanse on bone should be 0.1 to 0.2 boluses, and then we have to do a separate bolus if I want to add more volume. I might change the needle, sorry.
Yeah,
So
if you
for
want
bone
to,
injections, I'm using the needles that come in the Ellanse box, which is 1 inch 27 gauge needles. And I am doing deep temple gunshot boluses on bone. And for this area and in general, I find for bone injections, after about 3 injections, my needle will blunt. So I regularly change my needle after about 2 to 3 injections on bone. So again, I'm doing another bolus on bone on the upper temple. Okay. And as I said, the upper part of the lower temple is still safe as long as I can reach bone. So it is deeper, but I'm still on bone in this area. And I probably won't proceed any lower than this point for the temple area. So for the temple injection, I'm going to inject now into layer 4 in this area. And the way that we access layer 4 in the temple, it's consistent with the layer of the bone on the forehead. So if I enter from the temple crest on the bone and slide down into the temple, I will be in layer 4.
so you can choose an opening from the temporal crest area to inject down. And naturally, the cannula will slide to the level that we want to layer 4.
And we would always use a blunt cannula to access this layer because it's the safest instrument to use. So no sharp needle apart from periosteum in this area. That was good. Okay, so I'm in layer 4 here because I know that I'm not superficial, okay, because Deb's quite thin. So I am going to do very fine linear threads with my cannula in layer 4 of the temple here. It's normal to get some engorgement of the superficial veins, purely just from irritation of the area, and they will settle down post-injection. I don't want to put too much product in this layer because we don't want too much pressure or any overfilling in the temple area.
Okay, I want to remind everybody that when we inject the bolus, like gunshot injection to the temporal area, Ellanse, each bolus should not exceed 0.2. So when you need more volume, you should inject more point. Instead of the way that we inject hyaluronic acid, sometimes we will inject like 0.4 to 0.5 for one bolus, but that's too much for Ellanse. So I want to remind everybody. So next, for the molar or cheek area, you can use also needle to inject bolus supraperiosteally, or you use cannula to inject deep and layer 2 for the whole area. So let us check the video.
So moving on to the cheek area, I've marked out certain landmarks. The inferior orbital rim, because we're not going to inject any Ellanse inside the orbital rim where there's little to no fat. I've also marked out the course of the facial vein, which is very constant in individuals, starting from the inner canthus of the eye where the vein runs superficially and then deep into the cheek at the anterior border of the masseter at the pre-mesenteric notch. So we know as injectors that to inject filler, it's safer to inject lateral to the facial vein. So the facial vein is a very good landmark for injecting the mid-face. I've also marked out the medial limbus line, which is from the medial part of the iris down, and that is where the infraorbital foramen sits under the facial vein, so it's more medial to the vein. I've also marked out what we call the lateral line of ligaments, which is from the lateral orbital rim down to the anterior border of the masseter. This line I've marked out because, well, number one, it shows where the facial artery enters the face, but also on the zygoma, there's the zygomatical facial foramen where the vessels and nerves come out of there. So I'm actually going to avoid injecting on this mark here on the cheek. So I will be more medial or more lateral if I want to enhance the lateral part of the cheek. So for the deep cheek, Deb's got what we call the more deep fat deflation and volume loss of her cheek, and it's therefore highlighting her mid-cheek groove. So therefore I'm going to proceed to do more deep injections supraperiosteally on her cheek area. You can use a cannula or sharp needle for this depth. And you can do a more superficial fanning method of product as well, but for deep volume loss I find that replacing it on bone is much more effective. Right, so I'm on bone here, and again, sticking to the rules of bolus bone injections with Ellanse, 0.1 to 0.2 mil boluses, and then I will have to create a new bolus if I want to add more volume.
So Amanda's used the needle technique for bolus to the supraperiosteal layer, but divided to different bolus to reach the area, the volume. So you can see her that you change the injection point by several points to reach the desirable result. Yeah, so separate to different bolus.
Okay, so after about 2 to 3 injections, I'll change my needle because it does get quite blunt. Okay, close. Okay, we'll go a bit closer. So I'm just going to advance a little bit more closer to the tail end of the tear trough, but I'm still underneath my inferior orbital rim. So I'm still where there is fat there.
Below the inferior orbital rim and the area. Okay, so let's move on to nasolabial fold. Also, you can use the bolus injection to the piriform fossa to deep supraperiosteally, and also you can use linear threading for the level 2 to smooth out the line.
So moving on to the nasolabial area, this is the area where the facial artery is the major risk structure here. The facial artery enters the face at the pre-mesenteric notch on the jawline, which is on the anterior border of the masseter, and it runs a very tortuous course towards the lips and nose, giving off branches to those areas. Superiorly, close to the insertion of zygomaticus major, the artery becomes very superficial at the nasolabial fold. So the upper part of the nasolabial fold is best to perform on bone in the piriform aperture in the canine fossa. And you can do very carefully with very experienced hands, more superficial fanning on the lower 2/3 of the fold. Yeah. However, I find once I've corrected the mid-cheek and the temple for lift, that actually helps lift the fold. So I find, apart from my bone correction, I often do not have to do any superficial filling. Okay, so I'm going to proceed to do deep bolus injection supraperiosteally in the piriform aperture.
So the principal injection is from up to
So just
from
straight
top to
onto
bottom,
sorry.
from lateral to
You can escalate
medial,
if you feel
and from
comfortable to do
deep
so.
to superficial.
So I'm on bone
So
here. I'm
once
just
you
going to stick to my rule, 0.1 to 0.2 mil boluses.
once you inject like
So doesn't
temple
need a
and
lot for this
midface,
area.
the nasolabial flow will
And then
improve
pull out.
automatically. Yeah. So for the bolus, deep bolus injection should be enough for most cases. So for the mandibular area, my habit is like this illustration. I will inject some bolus by needle, deep bolus to mandibular angle to give the lateral support, and then I will use cannula to smooth out the border between the mandibular angle and the chin. So by this method, I found that the jawline definition will be restored. For the chin, also you can use needle or cannula to mainly layer 4 deep injection, and then layer 2 or touch up. So Dr. Franco showed us the bolus deep injection of the Ellanse to layer 4 close to the bone bolus injection, and also you can inject one bolus less than 0.2 and bolus by bolus to restore the volume or the structure here. And he also inject the area in the labial mental sulcus to smooth out the border or for the myomodulation of the muscle. And for the chin, also you can inject the bolus to smooth out the border between the chin apex and the meridian line for the higher satisfaction rate. In this area, also you can use the cannula to inject subacute area to smooth out the border between lip and the chin. Okay, so for the case study of this 52-year-old female, I will show you step by step the method I used. For the frontal area, I choose to inject the 3 main fat compartment of the forehead by cannula, 3 opening to inject this area. And the temporal area, I choose to use deep bolus injection, 3 bolus to inject this area. And for eyebrow area, also I inject for her eyebrow support, and you can also use deep bolus bony support and linear threading for the smooth out border. In the zygomatic area, for the lifting, lateral lifting, you can also inject from middle to lateral to use cannula to linear thread injection of this area, but I choose to inject in bolus, like 3 to 4 bolus to give the lateral support. And the preauricular area also inject opening here to inject the whole area to give her the lateral support. For malar area, I use bolus injection to see if I can restore the volume here and improve her tile look and the eye back. And nasolabial fold, I inject mainly bolus on the piriform fossa, and I also do some linear threading for layer 2 to smooth out the nasolabial fold. In the mandibular area, also I give the lateral support by bolus and use cannula to smooth out the border between the jaw and the mandibular angle and the chin. to try to restore the jawline. For the chin area, since her chin is really good, not so bad, so I only inject like small bolus to a little bit elongate her chin, but not too much. So let's see the result. So after 1 month, you can see that after the whole facial injection, I remember totally from top to bottom, from forehead to chin, from lateral to medial, I inject around 10 syringe of Ellanse S in one section. So after 1 month, you will see that her result improve from upper, mid, and the lower face. 45-degree view, you can see that the overall volume replacement is achieved and she looks less tired. On a 90-degree view, the other side, you can see that we didn't do any botulinum toxin or energy-based device, but she looks slimmer, and also she feel that her sagging is improved by the injection. The other part, you can see the jawline and the segmental area. Let's check the mechanism. When you see after 1 month, the CMC effect should go down, and the PCL is just started to catch up the result. So in this period, it should be the less effective time after the injection. So all I want to remind everybody is it is advisable to inform the patient beforehand that the effect might diminish after 1 month. So before you inject the patient, you can tell her that the effect may go down after 1 month, but don't worry, the PCL effect will catch up gradually. You have to be patient. So it is advisable to inform the patient beforehand rather than afterward. So about 3 months, like 12 weeks, let's see the result. After 3 months, you can see the result persists. And you can see that her skin texture become better because the neocollagenesis effect. The other view, 90-degree views. The jawline is maintained. And when I observe this patient, I wonder, is this the maximum effect after 3 months? But something magical happened. Why? Because after 6 months, you can see the result is getting even better. And there's no body weight change of this patient. So you can see that her tired look improved better than 3 months. And she looks slimmer, lifted, and more energetic. From upper, mid-face, eye bag become less prominent, nasolabial fold, and the jawline, segmental area. Let's see this 45-degree view. You can see that even after 6 months without any touch-up or any other treatment, the result persists and getting even better. The jawline and the segmental area also. You can see the jawline is more defined. The other view. But for the long-term result, I want to see the long-term result of Ellanse if I inject enough volume for one patient. So after 18 months, you can see that there's no body weight change also, and she did not receive any other injectables between this period. Only she has the laser to remove some spot of the skin. But you can see that the result maintains pretty good. So what we learned from this case, we know that Ellanse mechanism of action, the maximum clinical effect, the textbook or the guidebook tell us it's around 3 months. But in my experience, if you inject enough volume for the patient, the maximum clinical effect should appear in like 6 months. So you have to tell your patient to be patient about the result. So between 4 weeks or the period between 4 to 24 weeks, you should be careful. You should be very careful that don't over inject, because when the neocollagenesis effect is reaching its maximum, but during this period of time, if you are not very satisfied of the result and you keep touching up, keep injection in the same area, maybe you will end up with a visual overfilm syndrome. So be careful, and you should be more cautious about the neocollagenesis, because Ellanse is the collagen stimulator. It's not only a filler. You cannot treat this product as the HA. Like the bolus that we inject should not exceed like 0.2. You should inject tiny bolus to reach the maximum result. So for the last part, comparison of other biostimulator. For Acethyl, that we know that the PDLA is the powder film, and the particle size is 30 to 17 micrometer. And Acethyl consists of irregular and uneven distributed particle, and it's more prone to induce inflammatory response, and the immediate effect is not as good as Ellanse. So Ellanse is ready to use. There's no reconstitution needed. All you want to need is to mix some lidocaine. And like the case that I share, that the time efficient, only one section is required to achieve the optimal result if you inject enough volume. Not like the powder film, like PDLA, biostimulator, or PLA, like Sculptra, you need multiple sections to reach the result. And about radius, it's quite similar, but the main difference is the composition of CAHA, and also it is suspended in CMC. And for the radius, the longevity is not as good as the Ellanse. So you should use multiple section to reach the desired result that we want. And for Ellanse, you can reach the desired effect in one section. And CAHA, it's good product, and Radius is now it's rebranding to the biostimulator mainly, and not for volume effect, at least in Taiwan. So I will treat Radius like collagen stimulator, not a filler, by the main purpose. So now Radius, they suggest us to do the hyperdilution for the neocollagenesis instead of the structural support. So the main difference is the longevity. So if you want to reach the good result by Radius, you should use multiple section injection. About Gauri, I'm sorry that because in Taiwan we don't have Gauri, and I heard that there are Gauri in Indonesia, and it is composed of 100% liquid poly PCl, and it is 210 milligram per syringe. So for my understanding is that it's also for the neocollagenesis effect instead of the volume support. I think it's a mainly difference between Ogari and Ellanse. And it's pure PCL, and I think it's likely to migrate after injection. So you should treat this as a like powder form biostimulator to reach neocollagenesis instead of volume support. So it doesn't seem to provide contouring or reshaping ability. So I think it's the main difference. Sorry, we don't have it in Taiwan, so I don't have the experience of Gori to share with you. So for today's talk, for summary, for Ellanse injection, some key factor I want to remind everybody that careful patient education before procedure is very important. And the deep injection is relatively safe and effective. Like the case that we saw, I was amazed by the deep injection only in the mid-face area to improve her eye bag, and gradually the eye bag become less prominent. And the neocollagenesis effect is real, and it takes longer time to achieve the best result than you think. So you have to tell your patient to be patient. Like after 3 to 6 months, you will reach the maximum neocollagenesis effect. To prevent the adverse reaction, it is important to avoid excessive repeat injection in a small area. And remember, the bolus should be not too big, like every bolus exceed 0.4 or 0.5, that's too much for Ellanse. So if a delay type reaction occurred in chronic, adding methotrexate regimen can be considered. That's for complication. So maybe next time I can share with you with some knowledge about that. So thank you. This is my talk, and this is my IG. You can scan it and add me if you have to send me a message. If you have any question, you can message me. And another QR code to scan to access the Sinclair College of Extra Training material and to become more familiar with Ellanse and the Sinclair product. Okay, thank you.
Okay, thank you, Dr. William, for your insightful presentation. We move to the Q&A session.
Yeah.
There is a few questions from our doctor participant today. I will read the first question in the Q&A column.
Yeah.
Okay. I see. Maybe the doctor asked about in the video. You pay. In the video, you pay what layer is she placing the cannula for volumizing the temple area if the entry is in the temporal crest?
Yeah, for the temporal crest, that when we use cannula, we cannot reach the bone, but we can pass along. When you inject along by when the opening is open to the temporal crest area, and when you inject by cannula, what I want to say is that when you use cannula to inject deep, and the cannula will go down naturally to the layer that we want is below the superficial temporal fascia, and to the loose alveolar layer, you will slide to the area naturally. So it's you can combine, like Amanda combine the cannula deep bolus gunshot injection to supraperiosteal layer, and then create the volume, and then use cannula to smooth out the surface of the whole temporal area. Yeah.
Okay, Dr. William, thank you. And then the doctor asked about the constitution Ellanse for rejuvenation.
Oh, constituent in the, okay. Usually I will mix the Ellanse each syringe with 0.2 cc lidocaine. So for the case that I show, the total amount of Ellanse is around 10 cc from top to for the whole face in one section.
Okay, so many doctors ask about this when I give presentation at workshop. So can we dilute the Ellanse with maybe sterile water or saline to make it into skin booster, Doc?
You mean hyperdilute Ellanse?
Yes, yes,
Ah, yeah. Usually I don't do that because, like we say, Ellanse we need the immediate supporting ability of Ellanse like bolus injection. So when you use the hyperdilution, you treat it like powder form collagen stimulator like PDLA as a field. But for Ellanse, I think the advantage of this product is to support and the new collagenous effect at the same time. So I won't give up the advantage of the Ellanse.
Thank you, Doc. And then the next question from Dr. Tania. What is the contraindication from Ellanse? How if we inject too much and how to resolve it?
The contraindication of Ellanse is that mainly the pregnancy or the lactation women, and when you have uncontrollable autoimmune disease, and when the injection area is infected, like severe acne or skin infection, it's usually not recommended to inject. And for the part of the contraindication is the mucosa area, like lip or around the very close to the eyes. The mucosa area is not recommended. Otherwise, because it is not hyaluronic acid, so there's no dissolving agent like hyaluronidase. So you should be bear in mind that the principle of low pressure injection, not too much bolus, and the linear threading by the cannula to avoid the vascular event. Yeah.
So if we found maybe a nodule or granuloma, can we inject the saline or sterile water into the area, though?
Yeah. For the complication, I think it mainly divided to nodule or granuloma, and for my knowledge is that granuloma is very rare because it's related to your patient's gene, and for the nodule, sometimes it's technical errors like when you inject too big bolus in one area. So when the nodule appear, you should use, first of all, I will use saline to irrigate the area to see if they can resolve. Otherwise, you can inject some. After this, if it's not work, you can inject some intralesional steroid or 5-FU to see the result, to see the resolution, as well as the systemic steroid intake to control the inflammatory response. And if the nodule appear, usually you take several sections to resolve the situation. So I think it's better to prevent beforehand, not to inject too much bolus in one bolus. Yeah, that's very important.
Okay. So Dr. Chacha is also asking about this, and then we move to the next question.
Yeah.
From Dr. Chandrawati. So, is there any maximum cc for Ellanse if we inject in one area or one cc or one session? And then also she asked about why only 0.2 cc maximum for the bolus.
Yeah, because for the safety issue, the for the maximum total for the whole face, I think there's for my case, I inject like 10 cc for the whole face, but I keep the principle that in every linear threading or every bolus should not to be too much, and to cover the whole face. You will know that maybe it will take more than 10 cc in one section for the whole face, from forehead, mid-face, nasolabial fold, chin, and the jawline. It should take more than you think, but you have to follow the principle that each bolus should not max exceeds 0.2 cc. And why? Maybe we can ask the manufacturer or the paper that it is not then standardized to tell us the answer, but just keep this principle, and you will have less chance to have the nodule formation or granuloma formation. Yeah, I think because we don't want the bolus to be too big, and it will diminish the neocollagenesis effect, and it will result less efficiently. So for a safety issue, I always teach my student to avoid the excessive bolus injection. Yeah.
Thank you. I see our participant here very excited. So there's a lot of question for you, Doc. Then the next question from Dr. Natalia. Can we inject Ellanse in submental area?
You mean submental fat area? I don't see the benefit of injection. Yeah, I for the submental area, for the support or to increase to improve the submental fullness, I will restore the jawline and the chin, and then the double chin area will improve if you have the support of your lower face, like chin and the jawline area. So I won't inject directly to the submental area.
Okay. Thank you, Doc. And then the next question is PCL and CMC can induce inflammatory response to atopy patients?
Actually, in the neocollagenesis or a biostimulator agent, we want the inflammatory response, but in a controlled way. So, I mean, if the atopic patient, if the atopic patient skin condition is poorly controlled, and I won't inject Ellanse to the patient, because I want her or his skin condition and inflammatory condition to be more stable. So if the patient with uncontrolled autoimmune disease, the neocollagenesis or biostimulator agent is not a good choice.
And then how about if the patient has a history of keloid before, Doc?
Usually, if it is real keloid patient, it is not advisable to inject Ellanse. But for hypertrophy scar patient, I think it's okay. But keloid is not suggested to inject Ellanse.
Okay, and then the next question is from Dr. Elisa. So can we layer the Ellanse with hyaluronic acid? Or if it's no, how long we can wait to add?
Before the injection did other injectable. Yeah. Even at the same time with different layer, I think it is okay. For some of my patient, I will inject deep the bolus supraperiostic injection of Ellanse and as well as the skin booster on the surface. So I think it's okay. So unless only if you want, your treatment plan or then the treatment layer, I think sometimes we'll combine the Ellanse to like low molecular weight or small molecular hyaluronic acid to the superficial layer. So yeah, I think it's okay. Hi.
Dr. Adele, we can hear you.
Yeah. Okay. So let's move on to the question. Okay. Share experience in complications. Yeah, for the experience of skin complication from the superficial injection, if you inject too much or in small area, also you will feel the fibrosis of the skin. But if you keep the principle of small volume and linear threading evenly, I think it's okay.
Okay, sorry.
Yeah. So the next question is how much volume or length injection in temporal area? Usually for the temporal area, in my experience, if I combine the deep bolus injection to as well as the cannula for the smoothing of the surface, usually 1 cc per size is enough. And when the maximum, in my experience, is because some patients want to have the lateral lifting, so I will inject more to the hairline for the lateral lifting, and maybe I will use like 1 to 2 cc per side, and I will divide it to different layer like deep bolus, bony injection, and superficial fanning injection. Okay.
Okay. The next question, Luke. What if we inject the Ellanse on the wrong layer? Maybe if it's too superficial. What should we do?
What should we do? We should observe, and if in the superficial layer, I think it's okay, and not too superficial. If the amount is not too much, I think you can observe to see the the effect of Ellanse. But if it is obviously to develop nodule or visible nodule, I think you can use normal saline with cannula to irrigate the nodule after the injection to disperse the particle to more even surface.
Oh, okay.
How can we inject to improve teardrop Ellanse? For teardrop, with Ellanse, the improvement comes from the deep support of Ellanse. So do not inject Ellanse directly to the superficial layer of the teardrop. I would suggest you to restore the mid-face volume. And like my case, she has the eye bag and teardrop. and you inject deeply to the bone to give the midface support, and the teardrop and the eye bag will improve automatically.
And then can Ellanse we inject for the neck, Doc?
I don't inject Ellanse to the neck because there is no need for Ellanse to inject to the neck because we need a it's not the powder form collagen stimulator. Yeah.
Okay, so you don't recommend the Ellanse for neck?
Yeah, I don't.
Okay, thank you, Doc. And then next question, if the patient still don't satisfy after the result, how many months you suggest for the repetition?
Like I share in my case, if you inject enough volume in first section, I think you should wait at least 3 months to 6 months to add more volume. But like a lot of patients that we inject only a little bit to one area, and you can after the injection is not reach the result I want, and maybe the touch up time can be shorter. But if you for the first injection, if you inject enough volume, I will suggest you at least wait 3 months for the touch up to see the neocollagenesis effect, because the neocollagenesis effect of Ellanse is for real. And if you repeatedly inject in one small area too much volume, you will end up with the overfill syndrome.
Okay, and then the next question from Dr. Daniel. If we put Ellanse to the supraperiosteum, so how is it to stimulating collagen, Doc?
Yeah. It is still not only the filler, but also the collagen stimulator, even if you inject on the bone. Like the case that I share, the midface area, I inject tiny bolus to the bone area, but afterward, the neocollagenous effect started. Her eye bag or her teardrop improved automatically. So it's not only a filler; it's also collagen stimulator, even if you inject deep. And you can see the case that her skin texture become better after the whole facial injection.
Okay, Doc. And then the next question about hand rejuvenation. How many volume usually we need it for?
I would suggest to inject hand. Dorsal hand is a good choice for Ellanse because it will improve the volume loss and neocollagenesis. And usually for less severe case, 1 syringe per hand is enough. For a severe case, maybe 1 to 2 syringes per dorsal hand can be done.
Okay, thank you, Doc. And then the next question, after we inject the Ellanse, can we do the EBD like RF microneedling?
Yeah,
Oh,
we can also do it, but you have to. My habit is to wait at least 1 month for the EBD. Yeah, when you inject the Ellanse, for ideal scenario is that you do the EBD first and then inject the Ellanse. But if the order is another order, you can inject Ellanse and wait at least 1 month to receive the EBD like RF microneedling.
okay, thank you, Doc. And then finally, this is the last question.
Yeah.
Oh no, there's
Another one. Yeah,
Yes.
using on the bone, you are still aspiration.
What the aspiration?
Oh, yes. Actually, when you do the bone injection by needle, if you use 27 gauge needle with Ellanse, the aspiration is only effective when it is not prime for the first injection, because there's no Ellanse in the tip of the needle. The aspiration is meaningful, but after one injection, the aspiration is non-meaningful because this too sticky for the fluid to be resolved by aspiration. So you have to be careful to bear in mind that the injection should be done but in low pressure and small bolus, and be careful about the patient's pain or the skin. Is there any discoloration or skin condition when you inject? So when you use needle, you should be very careful about the anatomy and just keep the principle to do the safe injection. But luckily, I don't have the vascular occlusion of the Ellanse because I'm very careful about the bolus and the patient's response.
Okay, or is there any incident of allergy or other side effect you experienced before?
For the complication or the reaction, honestly, after the COVID time, I saw that some patients will have the delayed type reaction after the COVID infection or COVID vaccination. But usually, when you give them enough steroid or the to cool down the inflammation response, it will go away naturally. And but before COVID is less frequently see the reaction. But after COVID time, indeed, for all new biostimulator is the same. There will be some reaction after the infection. But if you use proper dose of steroid, I think the condition can be controlled.
Okay, thank you, Doc. So this is the last question.
Yeah.
So vaginal fillers is in demand lately, Doc. So the doctor asking about, can Ellanse inject to body
Yeah.
area?
Yeah, like dorsal hand or the chest, anterior chest area. Yeah, if you use good technique to use the fine needle injection, needle threading, and keep the principle, I think it's okay. And you can inject in some saggy skin around the umbilical area. Yeah, some doctor will do that. Yeah, and also use the cannula or the needle with tiny thread to improve the skin laxity of the around the umbilical area. Yeah, so I think it's okay.
The doctor asked about the vaginal area.
Oh, vagina. Oh, I don't have the experience of the vagina area, but yeah, I'm not the expert of this.
Okay. Okay, Doc. So because our time is limited, this will be the last question for you, Doc.
Yeah.
Okay.
I hope today's presentation is helpful for everybody. And yeah, if you have any question, you can Instagram me or message me. Yeah.
Okay. Thank you, Dr. William, for your clear explanation.
Yeah.
Okay.
Thank you.
Thank you, Doc. Thank you for your outstanding contribution to today's webinar. So before I end this webinar, I have some important things to announce. Megan, maybe you can share the promotion slide. So Sinclair Indonesia has promotion to our products that you can see on the screen. We still have good deal price for this webinar. And for more information about the product or workshop, you can contact our product specialist based on your area, or you can message to our Instagram at Sinclair_Indonesia. And then on behalf of Sinclair Indonesia, thank you once again for joining us today. Stay tuned for future webinars and events from Sinclair. Thank you.